Huge hopes are being invested in this little jab. The hope of life returning to normal before fear and masks and social distancing. But reality looks very different. The vaccination campaign has only just begun, and it will be months before anyone's guard can be let down. We don't want to split our society, and at this point, when not everyone can get vaccinated, and when it's not even clear whether vaccinated people might still spread the virus, there can't be any special rights for immunized people. That may be so, but divisions may crack open in Germany nonetheless. Restaurants have a right to throw out unwelcome guests. Businesses can decide who to employ. It's their right. Of course they can say, that's somebody who's a bigger danger because they haven't been vaccinated, so we want to limit our risk. Will Germany become a two-tier society? Airlines that only admit vaccinated passengers? Pubs which refuse entry to the unimmunized? How long does the vaccination work for? But otherwise, I'm in favour of people who've been vaccinated having advantages. Things should be the same for both groups, as long as it's possible that vaccinated people might still be contagious. There are people who can't be vaccinated for some reason, but there are also people who don't want it. Should I be considerate about them? The position of the German government is clear. No discrimination between those vaccinated and those not. And if necessary, that will be written into law.
Germany is reckoning with its highest daily coronavirus death toll. For the first time since the pandemic began, more than 1,000 people have died in a single 24-hour period. Germany had a relatively low death rate in the first phase of the pandemic, but has seen a steady increase in recent weeks. Restrictions meant to stem the spread of the coronavirus have been tightened since November. A current lockdown, due to remain in place until January 10th, now looks likely to be extended. Here's German Health Minister Jens Spahn speaking moments ago.
1,129 deaths this morning alone. 1,129 families will experience this new year in mourning. These numbers show how brutally this virus still strikes. The infection and death rates also show that we are still very far away from any kind of normality. So, in this situation, I don't see how we can return to pre-lockdown mode. As hard as it is, this also applies to New Year's Eve tomorrow. It is a necessity that this is to become the quietest New Year's Eve that Germany can remember.
I'm joined now by DW political correspondent Emmanuel Schaz. Emma, stern and sombre words from the health minister there. Even as the vaccine is being rolled out across Germany, what do these numbers tell us about the situation here?
Well, it simply tells us that the situation is not good. You've mentioned it. This is the first time that there's over 1,000 deaths recorded in a single day. There's more than 22,000 new infections. Now, the head of the Robert Koch Institute, which is monitoring the pandemic here in Germany, say that this could be due to the backlog, to the delay in reporting those infections over the festive period. But this could also be the sign that scientists were fearing of the beginning of a third wave for early January after the festive period. So just as Health Minister Jens Spahn said, this is bound to mean that we won't be returning to normal anytime soon.
Everyone looking for something to hang on to as we move into the new year. Emma, is there any room for hope in the near future?
Well, President Frank-Walter Steinmeier talked about the light at the end of the tunnel when referring to the rollout of the vaccine. So this could be the light. The only thing is that we don't know how long this tunnel still is, and the pandemic being far from being over. There's still some tough months ahead. Added to that, there's continuing protests from people who don't approve the handling of the pandemic by the government, or from anti-vaxxers. that being said, 2/3 of Germans plan to get vaccinated, and Health Minister Jens Spahn said he was hopeful that the vaccine will be made available to the general public by mid-2021.
All right, DW political correspondent Emma Shaz, thanks very much for that. Meanwhile, Britain has become the first country in the world to authorise the coronavirus vaccine developed by AstraZeneca and Oxford University. It's the second vaccine to receive emergency authorisation from the UK authorities after the BionTech-Pfizer jab. Trial data suggests the latest vaccine is less effective but easier to store and transport. Authorities say they plan to start rolling it out within days. Britain is struggling with a surge in virus cases that are threatening to overwhelm hospitals. I'm now joined by John Campbell. He's an independent health analyst and educator and joins us from Carlisle in the north of England. Dr. Campbell, thanks for joining us. This pandemic is hitting your country and so many others very hard at this time. How important is this new vaccine?
It really is, but this new vaccine is the best news we've had in the pandemic, and it is going to change the situation entirely. Now, in the United Kingdom, we're going to start a mass rollout of this vaccine from the 4th of January. We're going to be vaccinating 1 million people a week from that point, and that's only going to build up as the logistics and infrastructure develops. And as well as that, what we're going to do is we're going to give 1 dose of this vaccine and then wait a full 3 months before we give the second dose. So that means an awful lot of people are going to start to get a fairly good level of immunity straight away without waiting for the second dose. And of course, it also means we can vaccinate many more people. So it really is going to change the situation in the United Kingdom and in time in Europe.
But this vaccine, this new one, Oxford-AstraZeneca vaccine, is the second, but we've already seen in trials that it's not as effective as the BionTech-Pfizer one. Is it good enough?
It certainly is good enough. Anything over 50% is going to be efficacious. But we had the managing director of Pfizer making a press announcement just a few days ago saying the efficacy of this would just be as good as the Pfizer and the Moderna vaccine. Now, we don't have the scientific data on that yet, but it's looking very promising. And the key seems to be in the gap between the 2 doses. So giving a longer gap between the first and the second dose seems to increase the efficacy. So although we have efficacy figures of like 62%, 70%, up to 90%, depending on the dosing regime. What he says is we've found the right formula and we should be up there with the others. So we are expecting high levels of efficacy. So yes, it is good enough. And we believe this vaccine is safe as well.
Well, that certainly sounds promising. John Campbell, independent health analyst, thank you.
OK, thank you.